CDC dropped mask recommendations for a big chunk of the country, but around here, nothing's changed.
Many of our local counties are still in the high-risk zone, which means masks are still recommended. KCTV5's Betsy Webster joins us live to break down the numbers and what they mean. Betsy?
Yeah, well, the difference is what they're using to measure risk. Before, it was case numbers measuring the spread of disease. Now they're looking at hospitalization rates and capacity, which measures the strain on the system.
The real crux of this right now is you shift from a pandemic to an endemic. How do we live with COVID and how do we adjust to the ups and downs of it is going to be based on whether or not you have what your capacity is in hospitals.
The CDC has long advised mask wearing and other mitigation measures based on its community transmission risk map. They still do, but the map now looks different. The new guidelines mean a lot less orange on the United States map. What was 95% of U.S. counties with the old metrics is now 37%. But zoom in locally, and it's less encouraging. In Missouri, every single county close into the metro is orange or high risk. It's better in Kansas. Atchison is green or low. Douglas, Johnson, and Miami are yellow, medium. But Leavenworth and Wyandotte counties remain in the high category. One reason for that has to do with where the big hospitals are, where COVID patients are transferred from elsewhere. You see, the map is no longer about where you're more or less likely to get or spread COVID. It's where you're more likely to suffer the ripple effect of a strained system.
When the hospitalizations build up, deaths start occurring, not just with COVID, but with all the other diseases as well, because as we've heard before, you can't get access to the highest levels of care.
And he said in that way, this map is right on point. If you live, say, in Atchison County, it's considered low risk because you go to the hospital with a medical emergency there and you end up with a less strained hospital. You live in Wyandotte, you have a medical emergency, you come here, the closest hospital, and you have to compete for care with all of those COVID patients. Live in Kansas City, Kansas, Betsy Webster, KCTV5 News.